Welcome back to the ECG course. In this chapter, chapter 6, we're going to talk about the systematic approach. This is going to be a very quick video, and basically the concept is that always interpret EKGs the same way. Use an organized system to interpret the EKGs. That way you won't miss anything, and your interpretations will be much more accurate. So here's the method that I've devised. You can use this method or many other different methods to interpret your EKGs. But this just helps you remember what to look for. It's called the save it method. So all the letters spell save it. S for SA node activity, A for AV nodal pause, V for ventricular activity, E for ectopy, I for interpretation, and T for treatment. So when you're looking at the SA node activity, basically what you're looking for is the P waves, the atrial depolarization. Do the P waves march out? Because in order for it to be a P wave, your P to P interval, the spaces between the P waves, should be the same. And by doing that, by identifying each P wave and looking for them to march out, you might find some hidden P waves. That'll happen quite often. So you got to try to see if they march out and look at the spaces in between. You want to identify whether the P waves are positive or negative. Some arrhythmias cause the P waves to be negatively deflected. And you want to identify whether all of the P waves are the same shape and size. Some arrhythmias cause the P wave to change their shape or size from the last and from the preceding P waves, and so on and so forth. When you're identifying the AV nodal pause, the space between the P wave and the QRS complex, you want to identify the PR interval and the length of the PR interval. Remember, it should be shorter than 0.20 seconds, which is 5 small boxes or 1 big box. Okay, some heart blocks cause prolongation of the PR interval. Also, is the PR interval staying a consistent length, or is that length changing? If it's getting longer, that's another sign of a heart block. So we want to know, is it a short or long PR interval, and is it staying the same length? Also, we want to look at ventricular activity. We're going to identify that QRS complex. We want to know, is it narrow or is it wide? Remember, a wide QRS complex is one that's longer than 0.12 seconds, 0.12 seconds, which is 120 milliseconds, or 3 small boxes. If it's wider than that, it may be a sign of an arrhythmia. Also, you want to identify the RR interval and determine the rate and the regularity of that rhythm. And we've practiced that before. Remember, E stands for ectopy, so after we've identified all of that stuff, we're gonna look for all the extra stuff, all the extra beats. Is there a premature or an escape beat present? And you're gonna learn what those are in a later chapter. Finally, you're gonna use all that information that you've gathered together, and you're going to interpret the rhythm. All right, and once you've interpreted the rhythm, that's when you can start deciding on treatment. If this patient requires treatment based on the arrhythmia, well, we have treatments that are specific for those arrhythmias. So it may be a medication or it may be electrical therapy, and we're going to use our interpretation to identify the appropriate treatment, along with the patient condition, of course. And that's it. Now, the point of this chapter was to drive home the importance of using a systematic approach, and we're going to try to use that in the following chapters. If you want to get right into the next chapter, click on the right image there. That's chapter 7 on sinus rhythms. And those are going to be your normal looking rhythms. We've looked at a bunch of sinus rhythms already, but now we're going to actually see what they are. And we're finally going to get into some rhythm interpretation. If you want to go back and review, you can click on the left image there, chapter 5, rate and rhythms. Finally, don't forget to subscribe to our channel and leave us some comments below.